Hi, my name is Debbie Plass. I am Vice President of Marketing and Business Development at Sierra Nevada Memorial Hospital. Today, we're here to give you an inside look at the tests and procedures we offer here at the hospital. We know that with each new experience, there comes fear of the unknown. These videos are produced and created to ease your mind and to introduce you to our professional and caring staff at Sierra Nevada Memorial Hospital. Your health, our care, close to home.
Hello, my name's Ed Brantley. I'm a coordinator here at Sierra Nevada Hospital in diagnostic imaging. I've been a technologist here for 16 years, and my goal today is to take you through the patient experience for MRI and CT. Gail Mitchell. Good morning.
Morning.
My name's Ed.
Hi,
I'll
Ed.
be doing your exam today.
Very good.
We're going to head right on through the door at the end of the hall there.
Okay.
While we're walking down the hall, I'm going to ask your date of birth.
11456.
And I see that Dr. Smith has ordered an exam of your abdomen. Is that correct?
Yes, it is.
All right, well, come on back. I'll explain everything as we go. I'm going to have you step into one of our dressing rooms here.
All right.
The lights will come on when you move in.
Okay.
Let me get you a gown. I'll be right back.
Okay, great.
Here's your gown.
Oh, okay, thanks.
And Dr. Smith ordered a CT exam of your abdomen, correct?
Yeah, I never really got the chance to ask him, what is a CT scan?
Well, a CT scan is it's a highly detailed X-ray exam of the area of interest. In your case, it would be an abdomen.
Okay.
And it has an X-ray machine that revolves around your body and takes a very detailed data set of the area of interest.
So it's like an X-ray?
It is an X-ray,
Oh, okay.
yes.
All right. And as far as the X-ray portion of it, if it's a lot of X-rays, I'm a little concerned. I've been reading a lot about X-ray exposure. Is there anything to be concerned about in this regard?
Well, it does have a lot of X-ray involved with it, more than an ordinary X-ray would, but it does provide much more detail than a regular X-ray, a plain film we might call it. And our machine has software installed on it that it tailors each exam to the particular patient that is on the table. So patients of different size get a different dose. They get exactly the dose needed and no more for the size and to get the type of images that we need for a diagnostic image.
All right, okay. Yes.
Are you ready?
Yes, I am.
Come on out.
Okay. Do I have this thing on right?
You do. Did you get it tied okay?
Yeah, I got it tight.
Okay, well, let's go across the hall and take a look at the machine.
I was wondering, since you bring up the machine, am my whole body going to go in this thing, or what?
Most of your body. For the exam we're going to do, let's go in and look at it and you'll be able to see it better.
Oh, it's not too bad.
Well, this exam, I'm going to have you lay down on the table on your back.
Okay.
I'll give you a cushion under your knees.
All right.
You'll put your arms above your head.
Okay.
And then I'll move you into the machine about mid-chest.
All right.
Well, since this exam is with contrast, you probably drank 2 bottles of oral contrast this morning. Well, we have just a little bit more for you we'd like you to drink. It's about 4 ounces.
Oh, I have to drink all that?
Yes, I'd like you to drink it all. And what this does, it goes and it highlights or defines your esophagus and your stomach. Okay? Great. Do you have any questions about this exam at all?
Now, what you gave me to drink, where does that go?
It goes down your esophagus, highlights that a bit, goes into your stomach, helps the doctor see inside the stomach, and then it moves on into the small bowel and the large bowel, and it helps to contrast that so that they can see more detail.
All right.
Okay?
Okay.
So I'm going to have you sit down here and then lay back on your back with your head on the pillow.
That's good.
I'm going to give you a little cushion under your knees. And then I'll raise this table up.
All right.
We do have IV contrast that we need to use also. So I'll need to start an IV in your arm.
Oh, that's what I drank was not the only contrast I get?
No, that highlights your bowel, and we use some IV contrast, and it highlights your vascular system and your organs.
Oh,
so
okay.
it goes in, highlights your veins, arteries, spleen, kidneys, liver, things like that. Put a rubber band on up here. I'm going to wash my hands real quick while you go ahead and squeeze that rubber ball. Great, how you doing with that?
Good.
All right, you got a great vein right there.
Okay.
I'll go ahead and get this started,
All right.
and then we'll move on.
How long am I going to be in here?
This is going to take about 10 minutes of on-the-table time.
Oh, all right. It's not long.
Most of the time is taken up with just preparation. The scan itself doesn't take long at all. I just wanted to confirm that you have no allergies to the contrast. Any
No.
allergies that you know of?
Well, I've never had the contrast, the IV contrast before, but I am allergic to shellfish.
Well, that's not a concern. That will be just fine.
Oh, okay.
Okay? I'm going to go ahead and start the IV.
Alrighty.
And we'll flush it with a little saline.
Okay.
Seems to be working just great. I'll go ahead and connect you to the contrast here,
Okay.
and then we'll get the exam done. Great. Now when we start the exam, I'll have you put your arms above your head, move you into the machine about mid-chest,
Okay.
and you'll hear a recorded voice talk to you. It's one of my co-workers, so it'll be a female voice,
Okay.
and she'll let you know when to hold your breath, when to breathe.
Yeah, the breath holds very long.
It's about 15 to 20
Oh,
seconds.
that's not bad.
The IV contrast causes a warm flush sensation. So just before I give you that contrast, I'll come out and let you know that we're about to do that.
Oh, okay.
Okay, it should last for about 60 seconds,
Okay.
and then it fades away. It starts in your upper chest,
Okay.
moves into your pelvis, and then just kind of fades away over about a minute.
Are there any side effects to this contrast?
There can be, it's very rare, but some people can develop hives,
Okay.
or you could have a more serious contrast reaction, which was mentioned on the screening form.
Oh, yeah, I read that.
Okay, if that should happen, like I said, it's extremely rare.
Okay.
But if it should happen, we have a nurse across the hall, a doctor just across the hall, and we have all the medications necessary in the cabinet over here
All right.
to counteract that.
Okay.
All right,
Okay.
are you ready to go?
Sure.
Here we go.
All right.
I'm going to wrap this tube around your thumb a couple times,
Okay.
move you into the machine.
All right.
I'd like you to put your arms above your head and keep this one rather straight. There you go. Close your eyes for just a moment. And just listen for the instructions now.
Okay. You leaving the room?
Yes, but I can hear you. There's an intercom and I can see you at all times, okay?
All right, great.
Here we go.
You know.
Sierra Nevada Memorial Hospital features some of the fastest, most technologically advanced equipment on the market today, using scanners that produce up to 64 images per second.
Are you doing okay? All right, I'll be right in. We're all finished up. And that's all there is to it.
No kidding, that sure was quick.
Well, I'll bring you on out. Give me a moment to lower the table and then I
Okay.
can let you go.
Oh.
I'll show you the way back to the dressing room.
Alrighty.
Feeling okay?
Yeah, a little lightheaded, but I'm good.
Okay, let me know if that doesn't pass soon.
Okay,
Come on across.
okay.
We're going to go in dressing room number 2 there.
Very good.
Now your doctor should receive a report within 12 hours.
Okay.
Sometimes it's sooner than that.
Alrighty.
I do have a little pamphlet here that the hospital has printed up. It has answers to frequently asked questions, things like how to obtain duplicates of your images should you need them, some
Okay.
phone numbers for billing questions. It has good phone numbers there. It has
Alright.
just a lot of good basic answers to frequently asked questions.
Okay. Now, if I'm going to be seeing another doctor, how would I get a copy of the report to go to my doctor that I am going to be seeing?
You can stop at our reception desk in the front lobby and they
Right.
can put that doctor's name in the computer and
Okay, and if I want a CD of the images myself, you say I can just call that number?
you can.
Great.
Give them 24 hours notice and they'll
Okay.
have it ready for you when
Okay.
you come in.
And where would I pick that up?
Up at the hospital in diagnostic imaging.
I'm not quite sure where that is.
Okay, you know where the emergency room is?
Yes,
Okay, you go up to the emergency room,
okay,
walk in the doors, walk back, you'll see a hallway on the right, an
Okay.
ATM machine, and then a little alcove.
Oh,
And
is
that's
that
where
over-
diagnostic
Is that over
imaging
by the
is.
cafeteria?
That's correct, right across the
Okay,
hallway.
very good,
Okay, when you're finished, just out the door that says lobby, through the door at the far end,
okay,
and enjoy the rest of your day.
thank you, Ed.
You're welcome.
The CT scanner, bringing your health, our care, close to